Hello YouTube, welcome to my channel. Are you a Black woman seeking to have a medical procedure or treatment abroad? This channel focuses on medical tourism for Black women. So if you're interested in learning more about things like cost, pre and post surgical care, treatment, medications, therapy, and follow-up, and so much more, make sure you subscribe to my channel and hit the notification bell so you're notified when I post a new video. So my name is Dr. Natasha Ramatal, also known as the Medical Tourism RN. I'm not a physician, but I am a doctoral trained registered nurse who's worked in the emergency department and the post-anesthesia care unit for a number of years. So on my channel, as I mentioned, I cover all aspects of medical tourism for Black women if they decide to seek healthcare or treatment abroad for things from anything from cosmetic surgery to cancer or fertility treatments, in order for Black women to make the most informed decisions about their healthcare and to have the best outcomes and experience. So March is Colorectal Cancer Awareness Month, and I'm going to take the opportunity to discuss colorectal cancer, or CRC. So I have been personally affected by CRC in the past with a family member, and I am actually affected now with another family member, both Black women. So I'm going to share what Black women need to know about colorectal cancer. Okay, and for a bonus, be sure to stick around until the end of this video because I will share the 5 best countries for cancer treatment, so you don't want to miss it. So what is colorectal cancer? Okay, colorectal cancer is actually a disease in which the cells in your colon or your rectum actually grow out of control, right? Sometimes it is called colon cancer for short, but the colon is a large intestine or the large bowel, and the rectum is the passageway that connects the colon to the anus. Okay, worldwide, colorectal cancer is actually the 3rd most commonly diagnosed cancer. And it is the 2nd leading cause of cancer death. So among women, Blacks were diagnosed with a higher percentage, 84.3% to be exact, of colon cancers than for any other ethnic groups. That's astounding. Additionally, Black women remain at increased risk of advanced disease. So there are additional factors which are unclear, they don't quite know why, that are actually contributing to Black women's later stage at diagnosis. So let's get into this. Why is colon cancer more common in Black people on a whole? Because it's also more common in Black men as well. 3 things have been listed: diet, genetics, and lifestyle. So as far as the diet of many Black individuals includes more animal fat and less fiber, which are risk factors for colon cancer. So Blacks, Native Hawaiians, and Latinos actually reported a higher prevalence of obesity and diabetes than any other groups. So for dietary risk factors, Blacks, Native Hawaiians, and Latinos reported the greatest consumption of red meat. So that's something you want to think about if you have red meat in your diet. Lifestyle factors. So the lifestyle factors include things like higher tobacco-related illnesses, obesity, less physical activity, and lower intakes of vitamin C and vitamin E, all connected to developing colon cancer. So some recent studies have actually suggested that the use of vitamin C or vitamin E supplements, both of which are important antioxidants, they may substantially reduce the risk of colorectal cancer. So each of the vitamins has been shown to reduce tumor cell growth and carcinogen-induced DNA damage, basically the cancer-causing DNA that damages your cells, your good cells, right? So the mechanism of the action of the 2 vitamins against cancer or carcinogens is not clearly understood, but it's been known to help, okay? And then the 3rd factor, the genetic factors. So the genetic factors actually include a high incidence of mutations in what's called the KRAS gene, KRAS gene. That's a gene that makes a protein that's involved in what's called cell signaling pathways that control your cell growth, things like your cell maturation, and then also cell death. Okay, but this affects a cell's ability to repair errors in your DNA, which increases cancer growth. So those are the genetic factors. So what are some of the symptoms that you need to look for when you think about colorectal cancer? I want to make sure that you see a doctor if you have any of these following symptoms for more than a few days, and they're out of the ordinary, not contributed to anything else going on in your lifestyle, like stress or something you ate, etc. Okay. Any change in bowel habits like constipation or diarrhea or even narrow stool. Okay. Rectal bleeding, blood in stool making it look dark brown or black, cramping or pain in your abdomen, weakness and fatigue, unexplained weight loss, and then feeling like you need to move your bowels, yet it's not, that feeling is not relieved after you've had a bowel movement. That feeling is still there. Okay, those are things that if you experience any of those for more than a few days and nothing else seems to be a contributor, you didn't do anything out of the ordinary, make sure you see your doctor so that you can have that checked out. What's important is early detection. So screening and early detection plays a huge role in colorectal cancer and survival rates. So the American Cancer Society actually recommends that those with a higher risk for colon cancer begin screening at age 45. Now, if you have a personal or family history of colon cancer, it's recommended that you begin colon cancer screening 10 years before the age that the immediate family member was diagnosed with cancer. So if you have a family member that has had colorectal cancer and they were diagnosed, say, at 55, then you should be going to be screened at age 45. Okay. And you should also have more frequent screening, and colonoscopy should be the only type of screening test you do. You don't need to engage in the other tests since there is a family link. And in some cases, you may need genetic counseling as well. There are several screening tools available, including home kits and, of course, the colonoscopies. So a colonoscopy finds and removes any polyps before they can become cancerous. So what's a polyp? Well, a colon polyp is a small clump of cells that actually form on the lining of your colon or your rectum. Most are very harmless, but some of them can develop into cancer. So colon polyps often don't cause symptoms. And because of that, it is crucial that you get regular screening tests like a colonoscopy, because that can help ensure that polyps are identified and removed before they can develop into cancer. Colonoscopies can also find cancer early when it is still small and has not yet spread, making it a lot easier to treat and improve your survival rates. The single most important thing that you can do to reduce your risk of colorectal cancer is to simply get screened. It is really that easy. Follow up on any symptoms that I mentioned before if you happen to have them, but get your screening, especially if you find out that a family member has had colorectal cancer or has it. Okay. All right. As promised, I'm going to share the top 5 best countries where you can go for cancer treatment. Now, I notice I didn't say for colorectal cancer treatment. This is because with cancer, there's so many different types of cancer. So I'm going to give you the top 5 best countries where you can go for cancer treatment. And when I say cancer treatment, I'm talking about traditional treatment, Western treatment. And that's inclusive of chemotherapy, radiation, surgery, or a combination of those 3. So there may be other countries that are better when looking at, say, holistic or alternative or complementary medicine. But these countries actually invest in research and advancement in cancer, enabling for a quick diagnosis. And they also have a comprehensive healthcare system, which with early detection and treatment interventions and preventative measures that aid in boosting survival rates. So these are based on great survival rates after treatment in these countries. So if you're healthy enough to travel for cancer treatment, before you travel, be sure that you factored in time needed for adequate treatment and follow up in country. Remember, with cancer, it's not as cut and dry with treatment and the treatment results and side effects and those types of things. So keep that in mind because it's critical you do not fly too quickly after treatment. And I want you to be as safe as possible. Okay. All right. So the top five best countries for cancer treatment. Number one, Australia. So Australia actually suffers high levels of certain types of cancer like skin cancer, prostate, lung, bowel, and breast cancer. But it has the lowest cancer mortality rate in the world, which is a huge achievement. So this comes down to a couple things: their policy and planning infrastructure within their healthcare system, which actually comes out on top globally. So that makes Australia one of the top places to go for cancer treatment. Number two, the Netherlands. So the Netherlands also scores very high for care delivery. Overall, the healthcare system and their governance, in addition to its robust policy and planning procedures. But the Netherlands actually prides itself on how rapidly the diagnosis wait times are. They have a very quick turnaround. And in turn, that has the highest levels for survival. As quickly as you find out, the quicker you can treat it. And specifically for skin and breast cancers. Number three, the United States of America. So the US, they're actually host to the world's best cancer treatment centers. The US has high survival rates for colorectal cancer and the highest rates for survival rates for breast cancer, which are over 88%. And many of the world's leading cancer experts can actually be found in US cancer institutes. The drawback, of course, here is the cost for treatment, as it's very expensive in the US. Number four, Canada. So in Canada, the survival rate is actually above 93% for prostate cancer and breast cancer, with survival rates in Western Canada. And this is in particular being high. These are high survival rates in compared to Eastern Canada. Female breast cancer rates have almost halved since their mid 80s, and this progress is largely due in part to positive impact in their preventative screening programs that they have in place for their universal health care. Also, in addition to the actual treatments that are offered for breast cancer in Canada. Last but not least, number five, Finland. Finland is a leading country in cancer care as well as in diagnostics for cancer. Over the years, more and more patients have been going to Finland seeking better treatments, which has been enabled through the EU Patient Directive. So, what's that? The European Union Patient Directive. That's the directive that mainly addresses the responsibilities of member states, EU member states, in cross border healthcare. It regulates reimbursement procedures and coordinates European reference networks and health technology assessment in the EU. Now, Finland scores consistently high for treating a myriad of cancer types, including prostate, breast, adult brain cancers, and they also have a very high 5-year survival rate. Additionally, Finnish cancer research is also the most cited in the world. So there's a lot to take in there to consider for Finland. All right, there you have it. Now, it's evident that multiple factors actually affect the quality of cancer treatment within a country, from its own wealth to how the care is carried out, including screening and follow up, and also choosing whether or not you want to travel abroad for that medical treatment. And as I mentioned, cancers are not easy to provide you with information like which are the best places, because there are a number of factors to consider. And honestly, a lot of those factors are subjective. They depend on you and what your desires are as a patient. Things like the type of cancer, because there's so many types. So you may want to go to one of these countries, or you may want to single out which country treats your specific cancer the best and weigh your options. Also, stage of cancer. You want to know, when you decide you want to seek treatment abroad as well. You're going to think about what stage of cancer it was determined, or at the point you decided, I think I'm going to go abroad. Also, how aggressive is that cancer that you have? The choice of treatment. You may decide to go with traditional Western treatment, as I said, chemo, radiation, surgery, or a combination of those three, or complementary and alternative or holistic medicine. If so, that would be a completely different list of countries. Okay. Alternative medicine alone would make the top 5 countries I've shared for cancer treatment different. Also, there is no global governing body that accredits facilities offering alternative medicine, similar to how the Joint Commission International accredits and certifies facilities worldwide. Okay. The closest thing to the Joint Commission International for Alternative and Holistic Medicine is an organization called the International Practitioners of Holistic Medicine, IPHM. They're the largest leading independent professional accreditation board worldwide, specializing in certifying alternative therapists, practitioners, healers, beauticians, even, and also training providers who practice holistic and alternative therapies. So their aim is to ensure that these professionals adhere to high standards of good and proper practice, empowering you as individuals to access the best possible care and treatment. Now, this is not the same as a global accrediting body for facilities. It is for individual practitioners. So I just want to highlight that difference if or when you decide you are going to seek cancer treatment through medical tourism. Okay, so as always, I encourage you to do your research. Check the accreditations of the hospitals that you're considering, as well as the credentials of the physicians. Many sites post reviews from patients. You should read them. Also, check expat and repat sites and travel sites. They usually have a Q&A page. Post your questions and people will share their experiences with you. But until next time, be well. And don't forget to subscribe and click the notification bell so you know when I post the next video. Okay, thanks.